Time can be the most important factor when it comes to treating a heart attack. In today's Heart of the Matter, Doug Johnson explains why time is of the essence.
The most serious type of heart attack is when a coronary artery is completely blocked by a blood clot, what doctors call a STEMI, or ST segment elevation myocardial infarction. When that happens, quick diagnosis and quick treatment is vital.
And time is muscle. As that artery is blocked off, your heart, at that point, whatever part of your heart that artery is serving is going without blood flow, therefore going without oxygen. And irreversible damage is happening.
As a result, virtually all the heart muscle being supplied by the affected artery begins to die when cut off from oxygen. That's why doctors recommend calling 911 immediately if you think you're having a heart attack. Diagnostic care can begin as soon as the person is in the back of an ambulance. Dr. Thompson was part of an effort at Baptist Memorial Hospital DeSoto to connect ambulances directly to the emergency department.
We have the capability here at DeSoto for that EKG to be transmitted to us in the emergency department. So while you're en route, then we're calling cardiology, getting the cath lab in. All those things are going on simultaneously while you're being transported.
As a patient is transported to the hospital, information on their condition is sent ahead electronically, allowing doctors to determine how serious their condition is and having the cath lab ready to insert a balloon into a blocked artery to reopen it.
The quicker we get that artery open, the quicker the blood flow restores and the less damage is done and the less irreversible damage is done.
Several years ago, it could take between an hour and a half to 2 hours for a heart attack patient to get to the emergency room and receive treatment. National guidelines call for treatment within the first 90 minutes. Baptist Memphis and DeSoto have cut the time from getting the call to providing treatment to 60 minutes, 30 minutes under the national average.
If you have chest pain, the reason why we want to get our response times down, the reason why we want to get you into the cath lab in that kind of heart attack soon is because the way to relieve that, the best way to relieve that blockage is to open up that artery.
People with the most risk for heart attack should be the first to call 911 at signs of trouble. Those risk factors are typically the same for men and women. Age, over 40 to 50, history of high blood pressure, diabetes or cholesterol, and positive family history of coronary artery disease. African Americans are also at higher risk. Heart attack symptoms include shortness of breath, nausea or vomiting, and chest pain, which can include squeezing, tightness, or heaviness that may radiate to the arm, neck, or jaw, although the pain may not be quite as severe for women. For Smart Medicine, I'm Doug Johnson.